Doctors of Reddit, what's your thank god they came in for a second opinion moment? 10 days ago I saw a 22-year-old patient, a Pakistani foreign student. He had gone to another hospital some days before for a specific neck pain. They gave him ibuprofen and sent him home. Nothing had changed, so he came to the hospital where I work. He had low and persistent fever, refused paracetamol because of Ramadan, and swollen lymph nodes in his neck and clavicle. Sent him for a chest x-ray which showed a very suspicious mediastinic mass. He then had a CAT scan with contrast. That mass was enlarged lymph nodes as well. We contacted the hematology specialist and booked an appointment for the next day. It all suggests a lymphoma. Now, to be honest, I am not even sure I made a difference in this guy's life because it seemed advanced, but at least I pointed him to the right direction. Not a doctor, and this isn't about a human. On New Year's Day, 2 years ago, our little hound dog would not get out of bed. Her back half was unresponsive, and she would yelp in pain if anyone touched her. We took her to the emergency vet, the only place open to get care on the 1st of January. We were there for 6 hours. The place was a madhouse. Eventually, doc checks out our papa. They take a bunch of x-rays, and the doctor tells us that there are no breaks, which means there are likely lesions on puppy's spinal cord, and our options are either very pricey surgery and a significant quality of life decrease, or put her down and save her the pain. They give us some pain meds for her, and we take her home to think about the options. The next day, we get into our regular vet's office. Dog is still limping and heavily favoring a leg. Regular doc inspects Poochie and asks what other docs said. After hearing a doc's prognosis, regular doc advises us never to go back, and informs us that our dog likely banged her knee really hard on the bricks of our porch and was just being a baby about it. 2 days later, doggo is 100% fine. Thank you Hero Wars for sponsoring this video. Hero Wars is an online role-playing action game with a variety of PvP and PvE modes. Here I'm fighting powerful bosses in the campaign mode, classic fantasy game style. While completing missions, I can collect loot and upgrade my champions. There are over 50 unique heroes. Each one has unique abilities. Combine and assemble different teams to battle in the arena or traverse the endless tower. But the main party happens online. You can create guilds, fight with other players, and constantly rise in rank. Join the game now and get a super chest with a secret hero, as well as 62 emeralds and 30,000 gold. Hero Wars is available on mobile devices and also runs in a web browser. Scan this QR code or download the game from the link in the description. I'll see you in game. Not a doctor, I'm a unit clerk. One time a young guy came in complaining of chest pain and shortness of breath. He had been to an across town and had been sent home with nothing done to help him. One x-ray obviously showed he had a collapsed lung. The doctor that saw him was a kind of sleepy old guy who I had never seen show any emotion. When he found this out he was so frickin' excited and literally danced around the trauma room. Then I got to watch him put in a chest tube. It was a good day. I once had a surgeon sit by my bedside and wait for me to wake up from my surgery. Good old burst appendix. At 1 AM instead of going home to sleep. All because he just really wanted to tell me all about my weird appendix. Due to overactive keloid it had self-repaired several times and connected itself to most other things around it. He was so excited about it. I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time. And of course, those are the patients that have a brain tumor show up on their CT scans. A scribe here had a girl come in who was about 22. Tattoos, weird piercings, the whole lot. We work in an ED on the edge of a rural part of the state, so we get all kinds of weird people with weird, frequent complaints that you work up and almost always end up having nothing. At the same time, you get the people who have avoided doctors their whole life and have the worst of the worst diagnoses. She said her right leg felt funny while she was driving and then complained of other weird, brief tingling sensations in her arms. Further, she said she had a migraine this morning before work. She has a long history of migraines, etc. Essentially in the year it would have been easy to just treat her for a complex migraine and have her on her way, especially since she was asymptomatic at presentation. For whatever reason, doc I worked for leaned into the weird, disconnected paresthesias and MRI'd her probable signs of multiple sclerosis, and she ended up admitted for neuro workup. So she had been told her whole life she had migraines when in fact it was probably Ms. Sure, she never made the effort to follow up with a neurologist who would have definitely stuck her in the MRI scanner, but we also could have just as easily written her off as crazy and sent her home. As a scribe I've really learned the value of the statement I have a MRI CT scanner and I'm not afraid to use it. Also, I've become a big proponent of taking an extra step to prove people that there's nothing emergently wrong with them. I was like 10 and my parents took me to the doctor cause I thought I broke my leg skateboarding. He said it was a 3rd degree sprain, told me I'd be fine. I pointed out lines in the x-ray and he said they were nothing. I somehow convinced my mom to take me somewhere else and they confirmed I had multiple hairline fractures in my growth plate. I am always impressed when dogs go skateboarding and are clever enough to understand x-rays. Military doctors suck. Ask anyone. For the past 4 years, I've had abnormal pap results. Each year, they told me it was fine and that it hadn't grown or become worse. But no one would look further into it. They insisted I didn't need any opinions. Since I've been busy with life and work the past few years, I decided they were right. Cause I'm an idiot. Finally, my new doc saw the results and became immediately concerned. She asked if anyone had told me to do a biopsy. I explained what the previous docs told me. She shook her head and booked me an appointment with the dysplasia clinic ASAP. Turns out I had cancer cells that, while not fully bad, put me at a high risk for cervical cancer in the future. They performed a LEAP procedure and successfully eradicated what could have developed into something much worse. I'm so thankful to my doctor for knowing what was up and taking action. She's awesome and I'm going to be sad when she PCS. The exact same situation happened to me. Military doctors are the freaking worst. My dad went to the same ear doctor for around 9 years due to poor hearing, and was told there was nothing wrong. When he finally went to a second doctor, they referred him to the hospital and found tumors in his ears that had eaten entirely through his inner ear bones and eardrums. He needed 4 ops to remove them, 1 every 6 months. If the second doctor hadn't offered their opinion, he would probably have had tumors eating through the back of his skull into his brain. Not a doctor but have had a second opinion save my PP. Noticed blood in my urine and went to family doctor. Family doctor said it was a normal injury and would go away. Went for a second opinion with a urologist and after a bunch of tests they found scar tissue built up in my urethra that was causing inflammation and if left untreated would cause the urinary tract to close. So they removed the scar tissue and I about cried while peeing for weeks after, even while on pain medication, until it healed. But at least I could still pee and that was thanks to the second opinion. I'm not a doctor, but I had a fall and went to the emergency room complaining that my arm and back hurt. X-ray, fractured wrist. Cool. Now what about my back? Doctor feels around my back and says knots and tight muscles mate. Get a massage. It'll help. I wasn't gonna waste money on a massage, and went to my GP a bit of a while later and complained the pain was just getting worse. She ordered scans of my back. Turns out I'd fractured a part of my spine in the fall, too. Work with a doctor and worked up a patient once who said he had some floaters in his vision. He stated his optometrist said it was normal but he was going crazy trying to see through them all. We did some tests and he had a full-blown retinal detachment. Guy could have lost vision in that eye forever due to negligence. I'm glad he came to see an ophthalmologist that day. This is my own personal story. I am a NP and about 8 years ago, I began having yeast infections. I didn't think much of it at first. It happens. They began to become more frequent. I took diflucan. It would go away. Fast forward 5 years and I am now popping diflucan like Skittles. My OB-GYN told me, well, you just need to eat nothing but plain salad. Sometimes these are sacrifices women need to make. I'm not kidding. This actual conversation happened. Gyn is not my specialty but I did some research. I questioned if I might have some genetic deficiency and was told that's just nonsense and are you sure it's that bad? Eventually I was referred to a specialist who was negligent. She obtained a fungal culture, never ordered it, and then told me to go back to the gyn who sent me to her when I wouldn't stop inquiring about the results. I never gave up because I couldn't. I was in constant pain. I went to a new OB-GYN who obtained and ordered a fungal culture. She called me in a panic because she had never seen anything like it. I was referred to an infectious disease specialist and failed all treatment. I was referred to a different specialist and he took one look at my labs and shook his head. The yeast was resistant to every drug available. I also have a genetic deficiency where my body doesn't mount an appropriate immune response to yeast. So I took boric acid. It cured me. Poison saved my life. Not a doc, but happened to my wife and I. She was 3 months pregnant and did ultrasound. All normal. Baby heart rate was 99 and healthy. However, for some reason, the ultrasound tech forgot to measure something and doc ordered a second ultrasound. Second at in about a month. As my wife wanted to delay as she hated having to drink so much and not pee so the ultrasound comes out clearer. I couldn't be with her for second ultrasound as work got in the way. However, she calls me tearfully saying that the doctor ordered she abort the fetus for her safety and her health and she insisted on calling me to let me know before she did the procedure. Apparently the baby heart rate hadn't changed since first ultrasound a month ago, and this was bad enough to put mom at risk in pregnancy. I freaking flew to the hospital. I can't remember how I got there, but I crossed heavy traffic to the hospital in about 10 minutes of what is normally a 20-minute trip. Parked on curb, jumped out and rushed to her room. Thankfully nothing happened to her yet, and I just camped there insisting on another ultrasound. I kept telling the doctor it was a copy-paste error. You see, the heart rate from first ultrasound to second was exactly the same. I just knew, that the tech copy-pasted the first report and forgot to update that rate. I screamed bloody murder if anyone would touch my wife. Security was almost called until another doc came in and said just do another ultrasound to decide the issue. They ordered a second ultrasound and heart rate was normal. My son is now 10 and I remember that fear and rage every day I look at him. This is one of the worst I've read. When it comes to something as serious as this, you think they'd at least do a precursory double check. Thank God you were smart enough to make them. Had a patient that came in because she felt like she had lost a tampon in her vagina. 3 weeks ago, she had gone to see her PCP and been to an emergency department about this and they didn't find anything. She had some drug problems so they probably thought she was tweaking out. I didn't really expect to find anything, but there it was. You're on drugs, so I'm going to assume nothing else could possibly be wrong. Even though being on drugs is a huge cause of many other things going wrong. That's my logic and I'm sticking to it. Yeah. I'm not a doctor, but when I was about 10 I went to my pediatrician for sharp pains in my inner hip, which he promptly dismissed as growing pains. The next day my parents took me to a larger outside hospital where they found a, still growing, golf ball size blood clot between my hip bone and femur in a MRI scan, which had to be surgically removed over the next couple days. Doctor said that after my colonoscopy was negative, they could remove my colon for biopsy. I asked, horrified, if that would cure my disease. He said maybe. Went to another doctor and have successfully managed my symptoms, and I didn't have to remove a body part as a test. Frick that doctor. Doctor here. My last week of optometry school, a friend of mine had a patient who was coming in for unusual visual disturbances. Best she could describe, a corner of her vision looked odd and distorted. She had just started noticing a month or so ago, so she went to another optometrist who recommended acupuncture. She was not satisfied with their advice, so came to us at the school. She also had some unusual binocular vision issues noted during our exam that didn't seem to correlate with her complaint. We had her perform a visual field, which is a detailed test of a patient's peripheral vision. Sure enough, she had a defect, temporal in both eyes almost exactly respecting the midline. This is almost always textbook for a pituitary tumor. We cannot diagnose this based only on a visual field, so we referred her for an MRI. And to think she could have listened to the first guy and gotten acupuncture. That was my last week of school, so I unfortunately do not know what was found and how she's doing. Had a guy come in because he bumped his leg on a ladder couple weeks ago, had a sore with a bandage on top. I asked him to remove it and there was a stage 4 necrotizing ulcer under. Like, textbook. If he didn't come in to see what the doc said, he would easily have gone septic within several days. Kids, if your skin turns black or comes off to reveal a giant hole, go to an ER. I was told that this was just a really dark skin tag. I biopsied it. Melanoma. Stage 5. More specifically, Breslow's depth of 5.4 millimeters. My pathologists told me it was the worst melanoma that they have ever seen in their entire careers. Get your moles checked, Reddit. I can't stress this enough. Experience while doing residency in China. Kid came in via a reference from his village doctor. He had a few random episodes of seizures. Well, guess what? Imaging at our hospital showed that there were multiple lava cysts in his head. Yep, the kid loved to go to the rivers and put frogs into his mouth. He wouldn't eat them, but he would just lick them. Don't ask me why. NP here. Young lady comes into established primary care with 1 month of a swollen lymph node in her neck, malaise, feeling off, random fainting, persistent stomach ache, headache. Had been to the ER twice and they even did an MRI of her brain. They were going to refer her to a general surgeon for a removal of her lymph node and they never tested her for simple strep throat. Immediately positive in clinic 5-minute test. PT feels completely better with some simple antibiotics. Made me so angry. So even if you don't have a fever or a sore throat, a lot of other weird symptoms like those above can be strep too. Not a doctor, but this happened to me when I was 2. My parents have told me the tale multiple times. I started being a less and less cheery 2-year-old. I wasn't very communicative, so my parents inferred that I was sick. I would grab my stomach and bend over. It got worse when I ate or drank things. Obviously looked like I had some kind of stomach abdominal pain. My parents weren't sure what to do. We were very poor at the time. I didn't even have a pediatrician yet. They just took me into the ER worried it was something life-threatening. The ER doctors looked at me and told my parents one of my intestines was twisted on itself and I needed surgery within 24 hours. My parents were freaking out. My dad called old friend of his whose opinion he greatly valued trusted. His friend was like, have they cut into him yet? Stop. Take him to this pediatrician. My granddaughters all go there and he's amazing. They took me in for a second opinion, but didn't tell the pediatrician about the first opinion. Just said, hey look, he's in pain. What's wrong? Pediatrician took a look at me, looked in my throat and visibly winced. He wrote a prescription for amoxicillin and gave me an injection on the spot for some antibiotics. He said to make sure I take it twice a day for the next few days and I'd be fine in a few days. At that point my dad revealed the first opinion. He told the pediatrician that he had been told I needed emergency surgery. The pediatrician's response was, whoever said that was mistaken. He has a severe strep throat infection. The antibiotics will clear it right up. My parents asked about me holding my stomach. My pediatrician said that's a normal response in small children who feel the sore throat pain when swallowing. Sure enough, within a few days I was back to my cheery self. If my dad hadn't seeked out a second opinion, they probably would have gone through with the surgery, opened me up, found nothing wrong, closed me back up, given me antibiotics as a routine post-surgery thing, and those antibiotics would have fixed me up. Who knows if they would have fessed up to their mistake or my parents would just be stuck with a huge bill for a misdiagnosed problem. That pediatrician was an amazing man. He was my doctor until I turned 18 and my family recommended him to everyone and anyone that needed recommendations. He's long since retired, but I do think of him every once in a while. You the man. Dr. M. Not a doctor, but I heard my son's doctor say this. I took him to the ER late one night because of coughing and a high fever. They took an x-ray, gave him ibuprofen, and told us he was fine. Doctor showed me the x-rays to prove it and gave me a dirty look when I asked what the dark spots were. I told her she was an idiot and took him to urgent care 4 hours later. The doctor that saw him immediately diagnosed him with pneumonia and confirmed with x-rays. I flat out refused to pay for the visit and told them that if they persisted with collections I would push their incompetence. They never called me again. Good on you for being a concerned parent and taking matters into your hands when it came to it. Not a doctor, but my mum got hit by accident in the face with a cricket bat by my brother. She went to hospital and had x-rays. The doctor said the x-rays were all good and she will just have deep bruising for a week. After a week had passed, my mum was still in bed and bruising hadn't gone down. She also noticed a slight drop in her right side of her face. Go back to another hospital for a second opinion. Turns out she had broken 6 bones in her face and needed titanium plates in her cheekbone. We contacted the previous hospital about the wrong diagnosis and they had conveniently lost the original's rays. Oh, we love the NHS. I would like to know how your brother accidentally hit your mother in the face with one of those things. PS, glad it worked out for you all. I asked my internist what the cause could be for weird tingling sensation in my left arm could be. She told me it would probably go away. Half a year later I got diagnosed with a brain tumor. Now I've been cancer free for a year since surgery, but still, could've been better. Maybe if I wasn't sent off with it'll get better. You honestly lose track over the years. Seems like with every patient the more attention you pay the more unsorted missed things you find. Heart failure that is actually pneumonia. Oh look, that elective surgery patient nobody has listened to the chest of sounds like she has aortic stenosis. No, it's not usual for your potassium to be 2.4. You have a problem with your kidneys and we should do something about that. I don't think Reddit has a word count large enough. Not a doctor, but a paramedic. So hopefully I won't be laughed out of the comments section for this. About a year ago, I got called to a 15-year-old male who'd collapsed in the parking lot of his residential apartment complex. As a 911 service, we get called to a lot of situations that might seem emergent to people going about their daily business, but appear relatively routine or mundane to us in terms of acuity. Additionally, because it was 15 minutes before shift change, and 15-year-olds rarely collapse from spontaneous cardiac arrest, I was fully prepared to call BS on this before we arrived on scene. Turns out the kid was, indeed, in total arrest, and we took over from the bystanders who initiated compressions and went into full code mode. Our standards of care mandate that we work a code for up to 40 minutes, depending on patient presentation, before we call a doc for termination of resuscitative efforts. And so we worked this kid for 40 minutes in the parking lot and still had no return of pulses. At this point, and I still have no idea whether my decision was based on emotion, clinical observation, or just a gut feeling, I elected to transport a working cardiac arrest, something we rarely do, rather than call for TOR. Got to the ED, level 2 trauma, cath lab, primary stroke, great facility, wheel the kid with ongoing compressions and interventions into the room, and the ED doc, in my experience, a fantastic doctor, takes a look at the patient, feels for a pulse, and says, "This patient is gone," and gets ready to call it. Then he looks at me, and I'm pretty shattered at this point, and says he'll do an ultrasound to demonstrate. Conducts the ultrasound, and lo and behold, the kid's heart is beating, weakly, but beating. Kid gets transferred to pediatric, wakes up within the week, and attended a survivor's dinner 2 months ago where I tried not to cry excessively in front of him. Overconfidence and an inability to share prospective clinical opinions are a dangerous path to navigate in the medical profession. I was enormously lucky, as with this patient, to have multiple trained providers in this case, and if the doc hadn't performed the ultra, well, this story would be a much sadder one. Not a doctor, but we took my baby brother to the ER because of extremely labored breathing and he became really cold and uncharacteristically calm. They couldn't find anything wrong with him and sent us home with Tylenol. The next morning we went to a sick clinic and they took him to an out-of-town hospital immediately. The one here clearly sucks, with several different viruses and a double ear infection. He had to stay in the hospital 5 or 6 days and be on oxygen. The doctors said he could have died during the night he was sent home because the effort of breathing would have been too much, so he would have just stopped. He's happy and healthy now, though, thankfully. It seems weird that they gave a cold baby Tylenol. That drug is used for lowering body temperature, which is why it works for fever. Wonder what the rationale was there. Young man lost his hearing in his right ear suddenly. Doc told him it was allergies. Allergy medicine didn't make it better. He had no allergy symptoms. A year later he began to experience jaw pain on the same side. His doctor told him it was probably a toothache. He came to the hospital for a second opinion, and it's a giant brain tumor, scheduled for surgery within the week. From the other side, patient's mother who had to kick and scream for a second opinion. My daughter fell off the bed when she was 8 months old. I checked her over and nothing was obviously wrong. She cried for a couple of minutes and then seemed okay, but I noticed as the evening went on she wasn't crawling much. She would start to give a very angry yell, not a pain cry but straight pee off and sit back up. She went to sleep like normal and I started worrying if I should have taken her to the doctor right away. My hub says she seems alright. Let's see how she's doing in the morning. As soon as I wake up I decide I'm going to get her checked out. She's still acting normal except for not crawling, but she's playing and babbling and I figure I'm probably overreacting but I can't stop worrying. I'm at the doctor as soon as he opens. He tells me I should have taken her to the ER immediately after any kind of fall but doesn't think anything is wrong. He checks her arm, can't find swelling. She's not reacting to him manipulate her arm. He says she's fine. I ask if she can be x-rayed and he says it's not necessary. I answer that I want to be certain. He tells me it's overkill but if it makes me feel better then I should do it. He writes a note for the ER and we head there. A doctor examines her and tells me she's fine and that x-rays can be upsetting for babies and he doesn't think she needs it. He tells me if she continues acting funny for a few days I can bring her back. I ask what would happen if something was wrong and I let it go and treat it that long. He shrugs and says they can do the x-ray if it makes me feel better. There was a broken bone in her wrist. The doctor actually apologized to me and gave me props for pushing for the x-ray when I felt something was wrong. When it comes to my kids, I'd definitely rather be safe than sorry. My mother was pregnant after having had some miscarriages and unfortunately it happened again. They wanted to do a curettage to avoid infection etc. This was in the 80s when ultrasound technology was fairly new and thus only used in special cases. My father insisted that they did an ultrasound. He was a nurse working in the same department and knew many people there. Fortunately he did, because they found out my mother had been carrying twins, and one was still holding on to life. My brother turned 35 yesterday. Hi Em. Baby was 2 months old. He kept puking, had some coughing, just general sick but no fever. Husband took him to the pediatrician, who said he had a cold and it will pass and they wanted a swallow study on the baby to make sure things were going down like normal. Fine. 4 hours later the baby is still puking every feeding. Mom, take him to the children's ER. They tell me it's a cold and right when they are about to discharge him, I bring to the nurse's attention how his hands and feet are blue and I don't think it's just a cold. She gets the doc and he agrees to a chest x-ray. It's pneumonia. We go back to the bay where the bed is and while I'm holding him he goes lifeless and blue. They push atropine to get his heart going again. It slowed way the F down and end up intubating him. A weekend in the ICU and he was back to his normal baby self. Scary to think that my baby could have died during the car ride home if I didn't advocate for my kid. Patient had gone to the ENT's office with sudden new dizziness. The physician assistant who saw her ordered an MRI, but then recommended reflexology, basically a foot massage, and referred her to her friend who does reflexology. Patient then came to see us, primary care, 6 months later since she was still having constant dizziness. We looked at the MRI which was obtained months ago, and realized she had a stroke in her cerebellum. Upon examining her, she clearly had an irregular heartbeat and EKG showed she was in atrial fibrillation. Huge risk for stroke. It was difficult to convince the patient she now needed a neuro referral and blood thinners for her AFib, since her previous provider told her she was fine. Not a doctor, but therapist. I receive a patient who is bipolar. He came here because his other treatment wasn't helping him enough. After a small clinical check, it is super evident his symptoms don't match. Like, manic episodes don't last 3-4 hours. I tell him he is not bipolar, and he needs to completely change his med prescriptions. So I send him with a psychiatrist I personally know and I trust. He was not bipolar, but he was now addicted to the Xanax that was used to treat his alleged bipolar disorder. What happened was that he was getting angry really quickly, so his family told him he was bipolar, God knows why. He walks into the clinic and says, "Hey, I need help, I'm bipolar." The general doctor, negligent AF, throws his hands in the air and says, "I'm not qualified to treat a bipolar person." and makes a medical reference so he can see the specialist. In said reference, the diagnosis was bipolar type I. When he goes to the specialist reads the reference, sees the diagnosis, writes the prescription for the drugs he'll need and tells him to stick to it. Never sees him again. The Mexican healthcare system is a cesspool. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.